My name is Tim Babcock, and I'm the Director of Development for the College of Pharmacy. It's great to see everyone, and we appreciate your time this afternoon. On behalf of the URI Foundation and Alumni Engagement and the College of Pharmacy, I'd like to welcome you to our Dean's Forum, Thriving Under Pressure, URI's College of Pharmacy Beating the Odds. The goal of this program is to bring attention to accomplishments of the college, its faculty, and students. We will provide insight about how the college is prepared to address the ever-changing myriad of pharmacy issues in the time of COVID and beyond. Our virtual audience includes alumni and friends from around the globe, including the President of URI Foundation and Alumni Engagement, Lil O'Rourke, and Vice President of Alumni Engagement, Michelle Noda. Thank you for joining us. This is a milestone week for the College of Pharmacy and the university as we celebrate URI's Day of Giving tomorrow. This provides an opportunity to help students in need. As you can imagine, there are many, through immediate support. We will share more on that later. Please note that this program is being recorded for future viewing. We welcome your questions, so please submit them in the chat box where Amy Simonini will be monitoring them. Now I'm thrilled to introduce our fifth Dean of Pharmacy, Dr. Paul Larrat. Paul has led the College of Pharmacy since 2013. He has been on the faculty since 1984. In addition to a PhD in epidemiology from Brown, he earned an MS in Pharmacy Administration, an MBA and BS in Pharmacy from URI. Dean Larrat's research interests include drug benefit design, formulary compliance strategies, pharmacoeconomic evaluation, decision analysis, outcomes assessment, and drug utilization management. Among his many honors are a U.S. Congressional Health Policy Fellowship in the U.S. Senate, a NASA Fellowship at the Kennedy Space Center, and in 2019, he was recognized for career achievement and service by the Providence Business News as one of the inaugural 25 over 55 regional leaders. Welcome, Dean Paul Larrat.
I appreciate your introduction. I want to welcome everyone. Thank you for sharing your lunch hour with us. And thank you for your commitment and your support over the years to the college. It's greatly appreciated. My job today is to set the stage for this discussion. And it's about not only how we're striving to get through the COVID epidemic, which is the preeminent issue of our day, but also navigating through turbulent times in the pharmacy education arena. And if I had to identify one other issue besides COVID that keeps me up at night, it's really a precipitous drop in the number of people that want to become pharmacists, that want to become our students. It's a very challenging atmosphere out there for our profession. And it affects not just our college, but it affects colleges throughout the country. So this is a national problem. Just to give you an example of what I'm talking about, we're seeing over the last decade a significant drop in the number of applicants to pharmacy schools, but also an increase in the number of seats that are available for students. An example, in 2010, so this is a decade ago, we had about 100,000 applications to pharmacy seats throughout the country. Last year, we were down to 30,000 seats, applications for seats. And just think about that. That's quite significant. If you talk about applicants, these are individual people. Two decades ago, we had about 14,000 applicants for about 7,000 seats in colleges of pharmacy. So one applicant for each seat that was available. Last year, it was about 11,000 applicants for about 13 or 14,000 seats. So now we're at a stage where any student that wants to apply to a college of pharmacy theoretically could have a seat available to them. So very different from what it was in the past. And what this is doing nationally, and these are the headwinds that we're dealing with, it's leading to program closures. We've seen a few in the recent couple of years. A recent set of studies in the private sector indicate that maybe 15 to 30 pharmacy schools throughout the country may close down in the next 5 years. So it's affecting the fiscal health of colleges throughout the country. Class sizes are decreasing. We have 10 schools of pharmacy in the New England area. 9 out of the 10 have seen their class sizes decrease. Just a couple of the more egregious ones, and I'm not naming names here, but one college, they shoot for about 60 pharmacy students in each class. They're running with 22 pharmacy students in their P2 class. Another college, they shoot for 100 in their classes, and they have about 42 currently. So this is real, and it's of staggering proportions to some colleges. So those are the headwinds, COVID and admissions, if I had to put it succinctly. So what's your College of Pharmacy looking like right now? How are we coping with what's going on? First of all, what's our student body look like? Some of you haven't been down here in a while. About 1,000 students in the College of Pharmacy. 3/4 of them are PharmD students, which you're very familiar with. The other quarter are BS, MS, and PhD students in the pharmaceutical sciences. So that's a group. As I said, we have 1,000 students. That's been pretty consistent over the past decade. So we are maintaining our pool of students. We're trying to diversify that pool. This year, we started a bachelor's, master's, and PhD program in interdisciplinary neuroscience with 2 other colleges at the university, which kicks off this year with an inaugural class of 50 students. So we're marching ahead with that. Class of the incoming class. So these are the students that come out of high school last year. They made it through the gauntlet of COVID over the summer and actually landed in the College of Pharmacy in September. And we shoot for a class size of about 130 students. We had 134 students join us this year. So very different from the experience at some of the other colleges. With the BSPS program, Bachelor of Science in Pharmaceutical Sciences, 31 students enrolled in that program. And that's within our range of what we're trying to attract. You might think, well, are these good students? Of course they're good students. If you just use a common indicator, SAT scores. For the PharmD program, SAT scores have plateaued and have been steady for the last 5 years. And the BSPS program, they've actually been increasing significantly over the last 3. So that's a good sign for all of us. So that was our incoming class. What about our outgoing class? Class of 2020 just left us. And where are they headed to? Well, first of all, most of them, I shouldn't say most, almost all of them have jobs or experiences awaiting them as they left here. Back in the day, when I was a student, and many of you were students, about 3/4 of the graduating students went off into retail pharmacy. So 3/4. At the College of Pharmacy at URI, it's about 1/4 now, so 25%. A full 50% of our class of 2020 went on for postdoctoral residencies and fellowships, competitive program. So that's very different. In fact, it was the highest in the Northeast as far as gross numbers go. So we're #1 in the Northeast in that marker. The remaining 25, man, I love pharmacy because of the opportunities and the diversity of what someone can do with a pharmacy degree. And our students have taken full advantage of that. They are out in long-term care facilities, they're in academia, consulting, industry, they're working in clinics, they're working for the government, the list goes on and on. And I guess this is the shout out, because many of you are preceptors and mentors. And I just wanted to mention that we couldn't do our job without you helping us. And we strive through all of our programs to make sure our students not only sit in a classroom and learn, but also apply that learning in real world settings. And what you do as preceptors and mentors is greatly appreciated. With our PharmD program, we place about 1,000 students out there each year. There are about 400 preceptors working with our PharmD students throughout the world. With our BSPS program, we want to make sure that every single one of them has an experience in a laboratory or in a pharmaceutical company. So last year, about 60 students were placed in laboratories for an experience, and about 30 went off for internships in the pharmaceutical industry. So thank you for all that you do. Then finally, that kind of summarizes what's happening on the teaching side. Finally, the other side of what we do is research. And it used to be a 50-50 split between teaching and research if you look at our budget. Research is taking on a much higher prominence within the college. And in the last 5 years, we've seen what I think is an incredible increase in the amount of funding that we receive and the amount of output that our faculty and researchers are doing. To just give you some gross numbers, 5 years ago, federal funding to our programs NIH, USDA, was about $6 million, and now it's $18 million this past year. Overall funding, which includes other sources, went from $7 million 5 years ago to $21 million this past year, and we anticipate that it's going to accelerate further. What this does is place us among the top 10, the top echelon of research universities throughout the country. So with federal funding, we were placed 8th in the country out of 143 schools of pharmacy, so 8th. And you know, we keep chipping away at it, we keep creeping up, but at some point we're going to hit a ceiling. But you know, 8 is great, and that's something we should all be proud of. How are we doing that? It's mainly through investment in new faculty members, new researchers coming in. I may have mentioned that throughout the region, most faculties of pharmacy are diminishing because of changes in the number of Okay, I'm back? Okay, sorry. We're investing in our new faculty members, and I had mentioned previously that within the region, most schools have diminishing faculties of pharmacy. We increased by about 18 over the past 5 years. So we are increasing. It's not because of our PharmD program or our BSPS program. It's because of the research that we do. And then just to summarize these issues about where the college is right now, you know, I'm an epidemiologist. We love our numbers and we love metrics. And we look at 5 key metrics in the college. And these metrics are really nice because they're national data. This is nationally publicized data. It's all standardized throughout all the colleges of pharmacy. It allows us to look longitudinally at how well we're doing. Are we trending upwards or downwards? How do we compare with others? And just to let you know where we stand on these issues, our pharmacy board pass rate is #1 in New England. We typically have 95% of our students thereabouts passing the boards on their first try. Almost all of our students are employed on graduation. That's tops in New England. One of the American Association of Colleges of Pharmacy surveys all the graduating students throughout the country as they leave. The best question they ask is, if you had to start all over again, would you choose your current school? Would you choose URI College of Pharmacy? And for the past 5 years, it's been between 95 and 100% of our students agreeing that that's what they would do. And you might think that's an easy one, you know, this a slam dunk for a College of Pharmacy, but nationally it's in the low 80%. So it's not just, there are some college students that don't like their College of Pharmacy, believe it or not. I had mentioned our success with the postdoctoral residencies. That is tops in the Northeast. And then finally, I had mentioned federal research funding, our 5th metric, which were obviously tops in the Northeast also. So where are we going? Before I turn it over to Kerry LaPlante, we have to get through COVID first. Accreditation comes up. It's 3 years out. We're starting to plan for that. A lot of work is going into the admissions issues, making sure that we have a steady stream of students, qualified students coming into us. We're also working to improve our diversity and inclusion efforts. College leadership is going to change over the next 5 years. Believe it or not, some of our faculty are retiring, and we're in the process of succession planning. Our neuroscience program is just up and going. We want to focus in on that. One of my projects is to diversify our income stream beyond just tuition and research dollars. So mainly that's development and public-private partnerships to create some more funding for the initiatives that we maintain. And then lastly, our greatest opportunity, I think, over the next few years is working with the university on the capital campaign. And this is, an effort to make sure that we fund all those things that meet our mission statement. And I boiled our mission down. It's sort of a personal mission, but I boiled it down to endeavoring to recruit, retain, and assure the success of the best and brightest students that are out there, the best stellar teachers and researchers, and certainly transformative leaders. So that's what we're trying to do with our work with the Capital Campaign. We appreciate any help you can give us during that phase of our next couple of years. It's appreciated, but it's also essential. So thank you all for that. That's the nutshell of where we are and where we're going. And at this point, I'm going to shift over to Dr. Kerry LaPlante, who is our department chair for the pharmacy practice department. She's actually not a URI grad. She is a Doctor of Pharmacy grad at Wayne State University. She also did her postdoctoral residency there. She's an expert in infectious disease pharmacotherapy, a prolific researcher and a great teacher. She's published over 100 peer-reviewed journal articles and book chapters. Her BSL-2 lab, which is located up at the Veterans Administration Hospital up in Providence, has received uninterrupted funding since she began her career, and it's been about 50 grant proposals later. She's well recognized in the healthcare community. She's past president of the Society of Infectious Disease Pharmacists. She's a fellow of the Infectious Disease Society of America and the American College of Clinical Pharmacists. It's by virtue of her infectious disease background that Kerry found herself as a leader in our efforts of February through October of this year on the COVID front. So at this point, I'd like to turn it over to Kerry for her perspectives on the COVID issue that we've all been dealing with.
Thank you, Paul. And that was a very nice introduction. Thank you for that. And thanks to Amy and Tim for putting this team together. It's nice to see so many familiar names and past students on this list. So really great to see you. So, you know, there's been an abundance of engagement from our students and faculty during these unprecedented times. You know, when I was reflecting back on how these past 6-7 months have been, you know, during those very dark days in March, while the country was shutting down, you know, our students and faculty here at the college were stepping up in full force, you know, embracing our sense of duty as healthcare professionals and researchers. I'm sure Paul can tell you, I can too, that the number of emails and texts from our faculty to see how can I help were abundant. It was fantastic to see. And I think that's truly our Rhody pride, and, you know, all of our alum, they're familiar with that. That's just kind of who we are. So I got to give Paul a lot of kudos for this, you know, and his great leadership, aside from like the remote learning team that he put together. And it really assisted our faculty to switch to remote learning on a dime. And it was amazing. We did everything we could for the students. You know, Dean Larrat also put together a COVID, we called it a COVID mitigation team. That included Dr. Brett Ferret, Todd Brothers, who's a critical care specialist, and myself. And he charged us to lead and organize what we called the College of Pharmacy Command Center. Long days and weekends. We were on call Saturdays, Sundays. We really got to know each other even more so. Paul would like to stream from all areas of his amazing house in Lakeview, which was fun to see. But we were focused on the students. We were focused on our clinical faculty and supporting them, and our researchers, you know, all framed in how we can help our Rhode Island community. You know, our first focus was on our students. Dr. Ferret and his experiential education team first reached out to all our P4 pharmacy students, asking for volunteers to assist in the COVID command centers and at our local hospitals. You know, at the same time, Dean Owens, she worked closely with the Rhode Island Department of Health Center of Professional Boards of Licensing to push through 90-day emergency temporary license for our P4s, the students that have already met all requirements for graduation early on. We pushed that through. That request was quickly approved by the governor and the Rhode Island Department of Health leadership. Dr. Bratberg and I are fortunate we have appointments at the Department of Health. And the beauty of our small state is we get things done quickly. And of course, we all know each other. So it happens effectively too. And we were able to quickly get our students in the field assessing our community. With regards to our faculty, I would say almost all of our clinical faculty They all volunteer to provide, whether it be emergency drug information services, registering for the Rhode Island State Emergency Registry of Volunteers, assisting with clinical dispensing at the 3 different COVID field hospitals, one at the Convention Center in Providence that was led by Lifespan, and one at Citizens Bank in Cranston, and then the other one in South County, which we just learned on the news yesterday. They're finally decommissioning 2 of those. We were engaging with the directors of pharmacy. Again, those are some of our Sunday phone calls with, Christine Collins at Lifespan, Brian Usiak at Kent, Jackie Constantino at South County. It was amazing, and they were so grateful for our help. We were really trying to do everything we could to help our pharmacy directors. As you all know, our college has vast expertise in our clinical pharmacy expertise, such as critical care, infectious diseases, public health, drug information, pediatrics, geriatrics, just to name a few. This team quickly came together to join forces with our pharmacy colleagues in the field, practicing at different centers to kind of start trying to answer all the questions that we were getting on drug information during this pandemic science period. It was really kind of drinking from a fire hose. While our clinical faculty were assisting their patients, our researchers, they were in their lab focusing on developing rapid diagnostic tests, working through quick IRB with the Rhode Island Department of Health, working with our industry and government partners. Our health outcomes faculty and epidemiologists were volunteering to assist the Rhode Island Department of Health with epidemiology. They're assisting with data input, data analysis, helping to take calls for our hotlines. And then the most exciting part, from an outreach and donation standpoint, our college donated more than 1,000 N95 masks, gloves, disposable gowns, face shields, IV poles, laboratory equipment, ventilators, hospital beds. Some of you may have seen the cover of the Providence Journal. It was a great shout out to our own Ian Lester. He led the donation of dozens of iPads to local hospitals that were really helping our quarantine patients connect with their loved ones in the outside world while they were battling COVID. And a couple really sad stories of patients that were, ready to pass away and were able to reach out to their family and loved ones through these iPads. The university donated IT support for the Fire Amazon tablets. And it's really important to know that these iPads and Fire tablets were all available due to the generosity of our alum and our donors, such as yourself. So we are very grateful. We will find a purpose for everything. And lastly, of excitement, I was supposed to have a sample here. I have the Rhody Blue. I don't know if you guys saw that. The college compounding team and staff members produced that hand sanitizer called Rhody Blue. 8-ounce pump bottles. There was also a Rhody Clear. They were distributed to our first responders, to legislators. And by the 3rd week of April, I think we might have burned out our team, but we distributed over 1,000 bottles throughout the state of Rhode Island. So as we reflect upon our most challenging days, perhaps in our professional lives, and maybe even in the college days, that it's so amazing to see the dedication our faculty have to our students. And I commend the great leadership that Paul has. And truly an honor to be part of this community. I'm not from Rhode Island and I didn't go here, but I'm not leaving unless they kick me out. So with all of that, and speaking of our students, I have the honor to introduce one of our P4 students. We have Aaron Perfetto here, class of 2021. He grew up nearby in Johnston. He serves as a tour guide for both the college and the university. He's also a URI 101 mentor for first-year pharmacy students. During his time at URI, he's been very busy, joined multiple organizations, Kappa Psi. He's vice president, or maybe he just recently served as vice president. Aaron currently works in inpatient pharmacy at Merriam Hospital in Providence, and he plans to pursue a residency in AmCare after graduation. So today, Aaron will discuss his experience as a student during COVID and his plans for the future. So Aaron, thank you for taking the time on your busy class schedule. I know you're on rotation right now, but I'm going to turn this over to you. Thanks.
Awesome. Thank you, Dr. LaPlante. I'm excited to be here to share my experiences in the college during COVID and plans for the future. So as a P4 student now on rotations, I can attest to both experiences with remote learning last semester, as well as the effect that COVID has had on experiential ed. So back in March, when it was announced we would not be returning back after spring break, my first few thoughts were, how will these last few months of my didactic coursework compare to the last few years in the program? But surely enough, within a week or so, the college was quickly back on schedule as professors and faculty had begun to tackle this monumental challenge of virtual learning through synchronous interactive classes and pre-recorded lectures that we as students were able to tune in and view each day. And as the weeks went on, professors were able to kind of evolve these methods for virtual learning by being open to students' feedback and concerns. And I think the biggest challenge, as I'm sure everybody here can attest to from working at home at some point during the pandemic, was adapting to integrating work with home life. Whether it was just even connecting to the Wi-Fi with all of your other family members being on at the same time, or fighting the urge to walk to the fridge every few minutes. For me, the challenge was being able to dedicate specific times and areas for studying in a new environment of being at home with family. As a student in my third professional year, I had established relationships with professors and felt pretty comfortable enough to reach out if I had any questions. But I can imagine this might have been a challenge for some of the younger students who may have just been introduced to professors just 2 months before or during the semester prior to going online. But I will say professors were receptive and definitely open to questions or concerns on all platforms, whether it was through email or some sent out phone numbers for any phone calls. So that was great. In the college, I will say most of our lectures are recorded. Most students use for reinforcement or just to catch something they may have missed during a lecture. So I think already having experience with pre-recorded lectures and also with our exams already being on an online software, I think pharmacy students were able to adapt relatively quickly to remote learning. And from what I've heard from colleagues and other classmates, this new integrated hybrid model that's in place kind of provides students the continued opportunities to receive the same quality education without losing the experience of traditional learning, that being of in the classroom. Then in regard to the efforts that students had made in response to the pandemic, as Dr. LaPlante had mentioned, I think students were eager to get involved as healthcare professionals. As a URI student and pharmacy intern with Lifespan, I had the opportunity to volunteer over at the convention center in Providence in the early months of it. Fortunately, this extra space hasn't been needed for patient care, but being able to assist in preparing the space allowed me to contribute on the front lines of the pandemic. And just to transition into a different perspective, I'm currently on my third rotation block at South County Hospital for my general medicine rotation. Despite some rotations having to resort to either only remote practice or shifting of a site, I think the experiential ed office has worked really well with students to ensure that everybody is able to complete their rotations. These unprecedented times have established kind of new roles for pharmacists and pharmacy students in all settings, as I'm sure everyone here can allude to. So, for example, as a student starting rotations in the midst of COVID-19, adapting to new patient care techniques became pretty crucial early on. So in my first rotation was a community outreach where normally students can give educational presentations at nursing homes or out in the community. But due to the precautions of COVID, we ended up being completely remote. But one project we were able to work on was connecting with older adults through Zoom or WebEx chats to provide education on COVID and give other presentations for common disease states or just to be that resource for patients in a time where some couldn't resort to their doctor for health questions. So it was nice to be able to bridge that gap in care. And being in the next wave of pharmacists now entering practice pretty shortly, I think we will continue to expand our role in public health. And I think this calls for an appropriate time to remind everyone to go get their flu shot. So as we kind of continue to adapt, the college has given us some resources and provided forums on online interviewing for preparing for either residencies or entering the job market. So as mentioned, I'll be graduating in May with the hopes of pursuing a residency. And I'm looking forward to what might be a new dynamic of will most likely be virtual interviews, but I'm just most excited to get out into practice. So I'd like to thank you all for tuning in. I will now turn it back over to Dean Larrat, and he's going to share a summary prior to our Q&A session. Thank you.
Okay, thank you very much, Aaron. I love the perspectives from both ends, the faculty and the students. So that's very helpful and appreciate it. For all of us, COVID has been tedious. It's been frustrating, or whether you're a faculty member, a student, a staff member, and certainly a healthcare professional. Last year, at the end of the year, I was talking to our graduating students, and what I would tell them is that, what an opportunity this is for you. I know it's tedious and I know it's not the best of circumstances, but what an opportunity. Learning about pharmacy, learning about healthcare during the most important public health issue of a century. What an opportunity. It's great for you. It's a chance for you to demonstrate your worth, your value as a professional, and frankly, do things that you would never do otherwise. What a time it is to make a difference. And, I'm very proud of our students as they went out, because I think most of them took that lesson to heart and have been involved, and they've been trying to make a difference in this epidemic. So this is a discussion, and there's now questions and answers to be made. And I'd like to turn this back over to Amy Simonini, who will be coordinating the question and answer session. So thank you, Amy.
Thank you very much, Dean Larrat. First question, how has the college's curriculum changed to meet the ever-changing healthcare scene? What new courses have recently been introduced other than the Bachelor's of Neuroscience?
Well, maybe Kerry and I can tag team on this. Well, I can talk a little bit about neuroscience, because that's our growing area right now. And actually, it came across my desk this morning, the list of new courses in the neuroscience area that are being introduced over the next 3 years. And it looks like it's about 8 or 9 new courses to support the courses that already exist. As you know, the College of Pharmacy has always had a great interest and expertise in neuropharmacology and the clinical aspects of neuroscience. So this just supplements what we're doing. Kerry, you have any?
Yeah, oh my goodness. The PharmD program is really kind of moving onward with a whole curricular revision that was voted on a couple of years ago. And I think, as most of you guys know, that all of healthcare needed an updated curriculum. Health education was becoming a bit stagnant. Professional education hasn't kept pace with vast challenges. This is across all of healthcare. And training and education was fragmented and outdated. So the American Association Colleges of Pharmacy had a goal of bringing in this new curriculum and having your students be both practice ready and team ready, very interdisciplinary focused. So we put together a curriculum committee many years ago, Paul did, led by our vice chair, Christy Ward, who has done an amazing job with all of the faculty, just kind of overhauling our curriculum and bringing our students to a more practice-ready, team-ready approach. I can go on, and I'll keep it brief. If anyone has other questions, I can expand.
Thank you so much, Dr. LaPlante. Aaron, a question for you. How have you balanced the heavy workload and curriculum with the added stress that the pandemic has caused?
Sure. So I think, pharmacy school, I'm sure a lot of us in the chat now have been through it. So it's definitely rigorous. And I think students learn early on. I know myself learned early on how to adapt and how to adjust to kind of the rigorous workload. So I think now, with the added stress of the pandemic, it's just making those minor adjustments to what is already kind of a big workload. So I think everyone kind of finds their own way of balancing, especially for those who work and also in class. I think for me, it's just being more cognizant at work, for example, of hand hygiene and whatnot. And also, as I mentioned, kind of designating time to work and to home life. So being sure to get work done. That way you can still, with everyone being remote, and I'm sure everyone's spending a lot of time at home, I think it's nice to get work done that way, or focus on work. That way you can focus on some other things, some other important things in life.
Thank you very much, Aaron. Your perspective is much appreciated. And now, with the college focusing on admitting the best and brightest, just like Aaron, how can alumni assist? What is their role?
Oh, I've got the answer to this one. So everyone that's out there now, friends and alumni of the College of Pharmacy, you're appointed now as College of Pharmacy evangelists. The best thing that you can do, this is your title, you'll get business cards, believe me, someday. What you can do to help is just get the word out about College of Pharmacy, the profession of pharmacy in general. Encourage people to talk to us. I will take phone calls from anyone that wants to call me, contact me. If they want to drop by, get the grand tour, we have folks that will do that here. Students will be helpful. They're the best, if you want to call it, the best salespeople for what we do here. And their enthusiasm motivates us also. So please, become involved and get the word out.
Wonderful, thank you. Kelly, a PharmD graduate from 2000, has a question. Is the college teaching current topics as we have a race to find successful treatments for COVID-19? Drug development, right to try, emergency use authorizations.
Kelly, it was as if you were in my class an hour ago. So I just got out of, it's ID core right now. It's October. I just got out of the pathogens lecture in antimicrobial stewardship. And I spent the week putting together our first COVID slide. So just the beginning, introducing what the virus is, vaccine options, treatment. As we know, we really only have remdesivir. I always say we're 300 days into this virus and we're learning a lot. But yes, that was my lecture this morning. And we are continuing to thread COVID into our interactive learning classes and throughout the semester. So yes, we are. And the emergency use authorization, that's a big topic for us as pharmacists. And, I don't know if you need help in that area, Kelly, but reach out to me and I can tell you what I know. Wearing my infectious disease pharmacist hat, I've been helping others navigate that. So I'll leave it with that.
Thank you. Aaron, I have a good question for you. What leadership opportunities are available for students?
Oh, sure, absolutely. So, so in the college right now, I think we're up to, I think approaching about 20 or so organizations, and I think it's continuing to expand. But across the campus, I think there's over 200 clubs or so. So I think just participating in these organizations, it's pretty relevant in the college. Most students are involved in one or multiple, depending on their interests. So I think there are opportunities in these organizations to hold a position or to gain leadership experience. In regard to pharmacy leadership, there's actually an elective offered, which I was fortunate enough to take with Dr. LaPlante as my professor, called Pharmacy Leadership, which mainly focuses on community engagement and civic responsibility for the things that we can do to expand the profession and take a leadership role in pharmacy directly. So I think that's definitely a powerful way to try to expand leadership and kind of reinforce it into the program.
And could I just add to that, knowing what other students are doing, we do encourage students to get involved at a national level. Many of the organizations that they belong to in the College of Pharmacy are branches or chapters of national organizations. So we try to support them, and actually through some of the great donations of our alums and friends, to get them to national meetings and to encourage them to run for offices on a national basis. There's so much to be gained from that.
Thank you, Paul, and thank you, Aaron. So, is the College of Pharmacy addressing the recent growth in entrepreneurship so that students understand there are multifaceted career options beyond traditional pharmacy? You mentioned that's only a quarter of the students now.
I can add to, we don't have the College of Pharmacy does not have an entrepreneurship class, but we do have quite a presence on campus for assisting businesses management, the MBA program. We do work with the Entrepreneur Center over at the College of Business, Entrepreneurship Center over there, and many of our students are involved in that. Our PharmD students also have an opportunity to pursue a joint degree, a dual degree of the MBA and their PharmD. So many of our students that have this entrepreneurial spirit to them migrate in that direction. I think we also try as best we can to make sure that people get involved in organizations outside of the college. And some of them are for-profit and some of them are nonprofit. But they certainly for some of those opportunities, students can see how entrepreneurs work and how they think.
Excellent. Thank you so much for the insight. We have a question from Christine, who's PharmD graduate 2019. Is there any room in the new curriculum to teach more about the increasing importance of managed care pharmacy and the effects on the healthcare landscape?
Paul, do you want to, since you have more involvement in the managed care, do you want to take that first? And I can.
I was going to turf it to you. Well, I could say through the new curricula, we're trying to weave more of those managed care concepts into the courses that exist already. As you know, Dr. Kogut and Professor Marcoux are critical to that, and they're trying to evolve the pieces of the curricula that we have set aside for managed care to incorporate some of the new strategies, the new managed care, the MTM and cost management types of strategies. So it's happening, but it's being integrated into multiple courses.
Yes, and I'll follow up by saying we have a whole new section of the curriculum titled Social Administrative Sciences. So it is formalized and now part of our new curricula. And it's led by everyone Paul just said, Rita Marcoux and Steve Kogut, Ami Vyas, Ashley Buchanan. I'm probably forgetting a few people, but a new formal component of our curricula.
Thank you. Would someone like to share what innovative and influential technological advances you see coming down the pipeline in the profession?
Well, I can address, let me address from the pharmaceutical education side. One of the good things about this COVID epidemic is that we've had to evolve very quickly to incorporate technology in the training and education of healthcare professionals. And it's not just simply recording a lecture and posting it on, on Facebook or whatever it is. There are a number of different platforms and techniques that we now use that we've learned about in the last 6 months or so. Some of them can be incorporated in telemedicine, and some of them have their roots in telemedicine. So I think that's, from my perspective, a positive of what's happening now. We're incorporating these techniques into our daily practice very rapidly.
Yeah, and I can just add with, a huge push for pharmacists as provider status, which, a lot of us are following policies and conversations with HHS on that. There's increased interest and need for our pharmacists to be providers, to have that status and increase any kind of telehealth communications with our patients and increasing our abilities to have that direct line. So yeah, I think there's lots of opportunities out there for pharmacy.
Thank you very much.
Amy, can I just go back to a past question?
Yes.
Entrepreneurship question. I was talking about formal didactic programs here and informal off-campus types of enterprises, but we also have our experiential education office, and they offer numerous electives in startup companies, in entrepreneurial settings, and frankly, in some very creative healthcare management settings. So I would add that to my answer.
Excellent. Thank you very much. How do you foresee balancing the school's educational mission, the need for new programming, and expanding on programming, with maintaining a prominent research program?
Okay, another one to answer. Well, there's a little bit of balance, because you have at the faculty member level, you have the balance of how much teaching I do and how much research I do. And that's usually the role of the department chair to help navigate that, because as you do more research, you might leave less time for teaching. The way I look at it, though, is research is really the foundation of our teaching. So by doing excellent research and having excellent researchers, that enables our teaching to be more effective. So I see it as an add-on and not so much of a balance.
Yeah, and I can add too, Paul. I never want to speak before you, so I'm giving you that courtesy. So, not that you care, but it's really integrated. And I think some of the best examples that we have, at least from a PHP standpoint, is that our faculty do a great job integrating their exceptional clinical service and their research and scholarship. Because we're faculty, we're clinicians, but we're also in academia, and it's our job to disseminate knowledge and to educate and to share what we've learned. So it's an exciting time. It's an exciting time, you know, even due to COVID and the opportunities and the direct patient care that we're having and additional research. And luckily the research dollars from NIH and NIAID is really increasing. So I think that could really help our college. A lot of our faculty have been funded on some COVID grants.
Thank you. We have time for just one more question. So the final question I'll pose to all of you, if you'd like to answer it, is what are some key priorities, both for the college and your specific programs for the next 3 to 5 years?
Do you want to start, Kerry? I feel like I'm usurping you.
You're right of first refusal.
Yeah.
Well, you know, as some of you know, I chair the strategic planning committee for the college, which is really exciting. And we have our 4 different buckets, which is our students, our faculty, our research, and of course, institutional effectiveness, which we've been doing a great job. I would say from a PHP standpoint and pharmacy practice, we as pharmacists really want to support and work together with our pharmacy colleagues out in the field to ensure that pharmacists can become providers. That's the top from a pharmacy practice standpoint. I think the world is our oyster. We are the medication efficacy and safety experts, and we really need to do a better job promoting that. We're a quiet, humble group, maybe not this group, but overall, you know, we kind of keep our head down, we're process oriented, we get things done, but, you know, I hope to lead this department to the next levels of excellence for our patients and our faculty. And my real job, as I told the faculty, is that if I do a good job supporting the faculty, they will do a good job supporting our students, because it's really about our students and making sure they have everything that they need.
Thank you.
And I just add at a college level, and I mentioned a few of these before in my opening remarks, but certainly leadership planning is a key priority for us. You know, as I said, we have people retiring, and that's and many of them you all know are, you know, stalwart people here that have been around for a while. But on the other end of the spectrum, we have many new faculty. I think about 50% of our faculty have been hired in the last 7 or 8 years, and they're ramping up the research and teaching efforts, and we need to support them and make them more successful, assure their success. So I think that's critical to us. And then lastly, you know, our student body's always been wonderful, and we have the best and brightest, the most engaged students. They're leaders when they get out of here, and we want to make sure that continues. We want to make sure we're inclusive about that. We want to make sure they're diverse, and we want to make sure they're successful. So that's I would say is a third key priority.
Great, thank you so much. I'll turn it over to Tim now.
Wow, this last hour was so inspirational and educational. This has really made all of us, I'm sure, feel proud of our alma mater. Thank you again, Dean Larrat, Professor LaPlante, Aaron, for sharing such incredible insight. And to those of you in our virtual audience, thank you so much for taking time out of your busy day to join us. Please keep an eye out for future programs from the College of Pharmacy. As I said before, you can show your Rhody pride and your Rhody spirit and provide immediate support to today's students through URI's Day of Giving, which is tomorrow. And in the College of Pharmacy, we have a $10,000 matching gift, dollar for dollar, for all gifts coming in tomorrow to the College of Pharmacy Annual Fund. So please make your gift during our Day of Giving tomorrow. We will send instructions for making your gift as well as recording of today's session in the very near future. Thank you again, and go Rhody.